Hey guys, welcome back to my channel. Thank you so much for watching. So today is going to be a really exciting video. I'm going to be talking all about family medicine residency and what does it entail. So today is actually March 19th, which is Friday, and today is the day that people who found out that they matched are finding out what program and what specialty they got accepted into and where they're going to be going now starting in July for the length of their residency. So it's really exciting for those of you who matched into family medicine. I'm so happy for you. Welcome. And I want to kind of give you a breakdown of what things you should be ready to expect when you start your program and just some tips and tricks and things that I did or things I wish I did before I got there. So one of the things about family medicine is that it is a 3-year program, like I mentioned before. If you're doing it in another country, it would be a different timeline, but in the US, it's a 3-year residency. Each year, different things happen and your growth really changes from when you're a first-year resident to a second year and then to a third year. So it's really exciting. And first year is obviously such a daunting year, and you hear all the horror stories and you think that it's gonna be like Grey's Anatomy or any of those other shows. And it's not, but it is in some ways. So I'm gonna walk you through it, okay? Now, once you found out you matched, there's gonna be a grace period where you don't hear anything from the program. But then moving towards May, June, you're gonna be getting hundreds of emails. You're gonna be inundated with emails from your program asking you to do these applications, do these training modules. You need to be certified in BLS, ACLS, PALS, and it can get very overwhelming. So just make sure you spread all of these things out and you take the time to focus on these different courses and make sure that you do them in a timely manner because you need to have all these certifications done before you start July 1st. So family medicine is split into 2 types of medicine. It is both internal medicine, where you work in the hospital and you have inpatient clinical experience, and it's also outpatient medicine, where you're working in a clinic for the other portion of the time. So what's unique about family medicine is that in your 3-year residency training, you have to see a total of 1,650 patients. And those patients have to be seen purely in your outpatient clinical time. These patients have to be something called continuity patients. So you have to have a patient panel and have patients assigned to you, and you over your 3-year time frame have to see these patients over and over again and have it accumulate to 1,650. That number is required by the ACGME, which is the governing body over how residencies are run. And this is the number that the ACGME has decided is a really important number to cross in order to feel that once they've trained and graduated you, that you're good to enter real life clinical practice. So that 1,650 doesn't have anything to do with your inpatient clinical experience. There are a whole different range of numbers and categories of patients that they want you to see in the inpatient setting, and those are split up into different things. Once you are in the hospital, it is a difficult experience because as a medical student you were observing, but now as an intern and moving into your 2nd and 3rd year, you're in charge. You're the one at the hospital running the service. You'll always have attendings and people supervising you, but that's not always the case. And I remember as a 1st-year resident when I started, they handed me the pagers, they gave me my patient list, and they said, there you go. Working as a resident on the resident service can be very time-consuming, can be very draining, and depending on how busy your resident service is, you're gonna be busy. You're gonna be pretty busy. So what I always try to say is you have to really focus on being organized. It's really easy to just pile all this work on and think about taking care of all these patients and doing all these orders. And when you just start out, you are not going to be organized and you're not going to be able to remember everything. So make sure you have really good organization skills and plans in order to make sure that you have everything done. Okay guys, I wanted to show you some of the documents I've made in order to help me with my hospital workflow. These are documents I print with me and keep them with me throughout my hospital day, and I use these for reference for all of the things that I need to do to make sure I stay organized. So you guys can keep these and download them, or I can email it to you, and these are really helpful to make sure that you are staying on top of your tasks, and you don't forget anything. The best thing to do is write it down. Pagers, pagers, pagers. Pagers are going to become your life. Now, some programs, they don't use pagers, which is amazing, but my program uses the typical old beeping, noisy, loud pagers, and it is really, really the worst when you have to deal with these pagers. But my advice is, once you get to working and you have your pager in your hand, that pager is your lifeline, okay? You never let go of that pager. That pager is more important than anything else. Phone calls from your mom, code blues. You have to address pages from that pager, because the pager is going to be somebody calling you from throughout the whole hospital, and it's really important to make sure you're on top of all of those calls. You address them all in a timely manner, and that pager is gonna be with you when you're even sleeping. You're gonna think about that pager, okay? In residency, you're gonna be dealing with on-call shifts. So 24-hour call shifts can be very draining, but they're not impossible. They're doable, and if you're organized, again, like I said, you split the time up between yourself and your senior or your team who you're with. You guys can take turn taking naps as long as somebody is awake while you're in the hospital. And those 24-hour calls can be really crazy, or they can be really quiet. You just never really know. So those 24-hour calls, be really ready to handle those, because they are not easy. One thing that happens when you're on call, and even when you're in charge of the resident service, is you're going to be doing procedures. So in family medicine, you will be expected to attend C-sections, attend live deliveries. You're going to be allowed to intubate during code blues. They are going to expect you to participate and put your hands on these patients and do what you can. So you can even run a code blue. You can be in charge of running the code, intubating the patient, transferring them to the ICU. They will look to you for the directions. So again, when you're doing all those qualifications for BLS, ACLS, make sure you have the algorithm on your phone. You don't have to memorize it, but just have it on your phone, review it before you go to your on-call shifts, and make sure that you're prepared for these types of emergencies, because you're gonna be ready to go, and they're gonna look to you as the doctor for that day for instructions, especially for surgeries. If you haven't been in an OR in a few months, make sure you review proper scrubbing technique and how to don and doff the surgical gowns and the gloves, and make sure before you even go to your first shift, talk to the nurses that are there and get an idea of what your glove size is. You could just talk to them and chat with them. Everyone will be really nice and willing to help you. Like I mentioned, you're gonna have a ton of administrative work. The work does not just stop when you start on July 1st. It continues for weeks and weeks, and then you have administrative tasks every month from your program that will just pile up if you don't get it done in a timely manner. So what I really recommend is that you go to Target or Walmart and you get a planner. So this is the planner that I have, and I have one from each of my PGY years. And what's really good about these planners is that they have tabs for every month of the year, like just right over here. Every month of the year, there's a different tab, and that way you can look at each month and write what is important for you to know or remember. Deadlines are really, really important, and if you don't do things by certain deadlines, you're gonna get in trouble. People are gonna look at you like you're unprofessional and you just don't know how to stay organized and do these things properly. So I bought a planner in my first year, and I've had them consistently, and I keep this in my bag with me. I bring this with me everywhere. In terms of staying on top of things, I use this planner. You can always use your phone, but I always find that writing things down is really helpful, because you're just gonna get so many emails and it's just gonna be hard to keep track of everything. So as soon as you see an email with something on there, put it in your planner. This will be your best friend, okay? Now going back to our clinic. What's really exciting about clinic is that you will have the opportunity to learn so much from your patients, and it's not just about talking to them and learning their different chronic conditions. You are gonna also be required to do a certain number of procedures. So the ACGME has a certain list of required procedures that you have to do in your 3 years of residency. So you have to interpret different blood work, so ABGs, chest x-rays, EKGs, splinting and casting of broken bones, suture lacerations. You're gonna have to be able to IND different skin lesions and abscesses, skin tags, different wounds. You're gonna have to do pap smears, pelvic exams. You're gonna have to do rectal exams. You're gonna have to be able to inject joints, and also you're gonna have to be able to do circumcisions on newborns. So all of these things are, you can split them up into what you can do in your regular clinic time and what you can do at the hospital. In the hospital, you'll have to do intubations, C-sections, vaginal deliveries, managing labor, the splinting and casting and things like that you can do at the hospital as well. So like I said, in your 3 years, you have to stay organized and you have to keep track of how many of these procedures have you done through your time, and that way, if you have it all in one booklet, then you know exactly what you've done and where you're at as every year goes by. On top of all of this, you're gonna have weekly lectures, you're gonna have didactics. My didactics are every Wednesday afternoon, and that is gonna be educational time where you're gonna be getting lectures and informative sessions from different people. Sometimes they're drug reps, sometimes they're your own attendings doing lectures. You might have simulation clinics where they're gonna help you with how to do these certain procedures on dummies, so then that way when you have the real patient in front of you, you've had some experience and practice. You're also gonna have to do lots of presentations on different articles. You are gonna have to do tumor board lectures. You're gonna have to do a project called a PICO, and you're gonna have to do a case report in your first year on an interesting case that you see during your first couple of months. It can get very overwhelming, like I said, and it's a lot more information and a lot more physical stuff that you're doing versus when you were a student and you were just standing there absorbing and just trying to stay out of people's way. Now, when you're the resident, you're the one in charge. And it can be a lot, but it's so rewarding and you're gonna have so much fun and it's gonna be so exciting. Another thing that is gonna be important is that you may or may not have to take step 3. And step 3 is an exam that traditionally residents don't study very much for, and it can be intimidating, but trust me, that exam is a lot more manageable than the step 1 and step 2 experience. There's an old saying that you need 2 months, I think, for step 1, 2 weeks for step 2, and 2 pencils for step 3. So the expectation of how much you have in terms of time to prepare for that exam, it goes way down when you become a resident. If you've taken it before you start your residency, that's perfect, but I would suggest taking some time after your day or things like that to review and prepare for that exam too, because it can be intimidating to take an exam when you're so busy. And like I always say, the USMLEs are really hard exams. So at the end of it all, after your 3 years, you're gonna have to take your state licensing exam, which is the boards done by the ABFM, the American Board of Family Medicine. Once you take that exam and you're all done and you're ready for independent practice, and then you are ready to go. So I am really happy to see all the people who've matched and who are gonna even be joining my program. I'm excited to see the journey of what people have to say and what their experience is about family medicine and where they go. What direction does it take them? I hope you enjoyed this video, me talking a little bit about the expectations about family medicine. If you have any questions or you want me to talk about anything in more detail, please let me know and I will try and get back to you guys. All right, you guys take care. Mwah.